This is our patient Twister. Hey Twister, how are you?
Pretty great.
Tell me what's going on in the last 24 hours with you. Don't give away your diagnosis yet. I want to give people a chance to guess before I tell them at the end. Okay?
Well, last night I woke up a few times in the middle of the night with sharp pains in my chest.
Sharp pains in your chest. Got it.
And so I came to the doctor today.
Okay. Now, you have a history of asthma?
Yes, sir.
How often do you have to use inhalers?
Usually every other day.
Every other day, okay. And that usually takes care of it for you.
Yes,
have you
sir.
ever had to be in the hospital because of asthma?
Only the first time I got it.
Very first time, all right. Okay, and did you take any medicines for the pain?
No, sir.
Did you fall? Did you have any trauma? Did you have an accident of any kind, fall off a ladder,
No, sir.
trip out the backyard, nothing like that?
Nope.
Okay, all right. And I'm going to tell everybody else, too, a couple of things, clinical things that we found on you just sitting in our exam room. Number one, you looked pretty good. You look pretty healthy right now. I mean, just looking at you, it'd be pretty difficult to decide that you're actually a lot sicker than you look. One of the things we discovered was that when we put a pulse ox reader, a pulse oximetry device on your finger, you were only sat around 92% on room air. Now, normal would be about 99%. So somebody with asthma that's that low, we would think that you're having an asthma attack, but guess what? You're not, right? But
Yes,
you do
sir.
feel a little shortness of breath, right?
Yes, sir.
All right. And so when I listened to your chest, what did I tell you? Something's wrong with you, right?
Yes, sir.
Because you don't have any very good breath sounds on the right side. Okay, so what we're going to do now is I'm going to take you to go look at your chest x-ray. Are you ready?
Yes, sir.
All right, we're going to stop. Okay, we're back in our little x-ray area with our pal Twister. And I honestly don't know how good this is going to show up on the video with the camera and everything here. But as you can see, this is a chest x-ray. There's the heart silhouette, the cardiac silhouette. These are the ribs. And over in here, there's something missing. You see that? Mr. Twisty?
Yes, sir.
Mr. Twister? Twister. Now you see these markings here, these lung markings? That's normal. You're missing them over here. And you see how this looks like that? Basically what's happened is you've had a spontaneous pneumothorax. Okay? You have a collapsed right lung. So unfortunately, you're not getting a lot of oxygen, or as much as you should, and that's why. So we're going to have to get you admitted to the hospital, and we're going to get you a chest tube and get this fixed for you. What do you think about that?
Sounds pretty great.
Sounds pretty exciting?
Yes,
Are you
sir.
nervous?
No, sir.
You're going to do great. Mom, are you nervous? A little bit? He's going to be fine. I mean, look at that smile.
What a week. What a week.
What a week, huh? He doesn't even look sick, right? All right, bud, you're going to be okay. Mom, it's going to be okay for you to drive him. Okay, it'll be just fine. Get some stuff done and get your lung fixed for you, okay?
All right.
All right, man. Thanks for letting us video your story.
You're welcome.
Yesterday, Dr. Gilmore told us that one of his lungs were kind of collapsed. So we are now at St. Luke's Hospital. Yesterday, they went in and put a tube in his lung. And tomorrow, he will be going in for surgery. They found a cyst on his right lung. So they will be going in tomorrow to remove it. That's the update for now. And, just hold on for tomorrow. This is Twister. He's headed in for surgery. Currently, he has a balloon in his lung, right lung. And they are taking him into surgery to remove all the bad. So, Twister, give us a wave.
So in surgery, this is what we found. Twister has a bleb. That is a bubble formed at the apical or top part of the lung, and looks kind of like a jellyfish in this picture. That is where the leak is, and that's going to be removed. And here are a couple of pictures of that the chest surgeon made performing a wedge resection of that part of the lung, just a very small part of the lung. That area is just taken out and sewn up, and that's all that was needed. All right, man, we're live. Where'd you just come from?
The OR?
Operating room, right? Yeah, you had a little dance with the chest surgeon, didn't you?
Yep.
How you feel?
Feel pretty good.
Okay, so let's see. Yesterday was your day to get into the hospital.
I kind of watched you all day today, thinking
No, Monday was my day to get in the
Monday.
hospital.
Have I lost a day in there?
Yeah,
That's
you
right.
did. I had a tube hanging on my chest for about 2 days.
I saw that picture. Yeah. You're a little grumpy, aren't you?
Yeah,
He's not as happy-go-lucky as he was on Monday.
Got here Monday.
That's right. It was later in the day though. Oh, that's right. You had to spend the night in the emergency room, basically, right? Because they didn't have any rooms in the inn.
Yeah, but I got a bed. She got the floor.
Yeah, I'm sorry about that. Sorry, Mom.
It's all right.
So, Twister, are you breathing better now?
Yes, sir.
All right, good. So I talked to the chest surgeon on your behalf and made sure that they used, an up-to-date surgical kit, things like that. Just some extra special stuff that some people don't get. That was a joke. You can laugh. No, never mind.
No one's laughing.
Not funny at all. All right, so they did a wedge resection of an apical bleb, is what you had. We've actually got some pictures of it, so we're going to try to put that in your video. You're going to be able to meet a lot of girls with this video.
That's what I'm going for.
Yeah, going for it. That's right. And Gonzo brought you as close a thing to a teddy bear as she could get.
Hey,
Gonzo's
I
here.
tried.
Gonzo's here. Why don't you show us, Gonzo? Come on.
I'm gonna have to show it.
Yeah, because.
Okay, I got him Spider-Man.
Yeah, we got you a Spider-Man teddy bear. What do you think of that? They're pretty cool.
And of course, get well card.
All right.
From
We got you
everyone.
a get well card, and so you're in our prayers. You got 3 or 4 more days here, and then you'll be home, and then you're over this.
Yep.
Okay.
I can't lift anything over 10 pounds for a week.
He's already told me he can't wash dishes now.
There you go. You won't be washing any dishes.
Nope.
All right, man. Well, we're glad you're feeling better, sort of. I mean, we're glad you're feeling better. We're not sort of glad about that, but we're glad you're sort of feeling better. Does that make sense?
Yes, sir.
All right. Good deal. All right. Well, I guess we'll see you down the road then, okay?
Yep. So you can pick up my letter.
That's right. We're going to get you a letter. Good grief. All right. You're okay if we share your video on the internet with all our fans? And...
Yep.
All right. You got anything you want to tell Gonzo here?
Thank you, Gonzo, for Spider-Man on my card.
You're welcome.
All right. If you need anything, you just give us a holler, okay?
Yes, sir.
All right. Let's see you later.
Good morning, everyone. This is Twister. It's the day after surgery. He's not doing too well today. He's feeling a lot of pain. Definitely not as happy as he was yesterday. Definitely as grumpy as he was yesterday. He is running a little bit of fever and in a lot of pain. They are bringing him some pain meds right now. He is trying to work his lungs on this. Trying to do a little bit of breathing exercises to help build up his lungs. So other than that, that's the update for this morning. They will be headed this way with some pain medicine. Twister, do you have anything you want to say? Okay, have a good day. Good morning, guys. Here is Mr. Twister again. He is going to try and do one of his lung exercises. And let's see where he goes with this. Can you do a little bit more? See if we could get what it's saying on here. Try one more time. Okay, so that's Twister trying to use the little breathing machine they gave him. As you can see, he's not doing too well, but he is making it. They just gave him a pain shot about 5 minutes ago, so the fever is down to 99. So here's Mr. Twister. It's day 2 of recovery. As you can see, we are up and out of bed. We are hoping to get the tube out of his lung tonight, and if that happens, we possibly can go home tomorrow. This is the update on Mr. Twister. They are hoping to send him on a little adventure, walking adventure here shortly. So this is Twister. This morning we got the tube taken out. Twister, how do you feel since the tube's been taken out?
Great.
So, do you feel different with it?
Yeah, I'm not in pain.
Good. Can you breathe a lot easier?
Yes.
Yes. So that's the update for Twister. We are looking at him going home tomorrow. So we're pretty excited. Twister, can you wave bye to your fans? Thanks for watching.
Hey folks, you spoke and we listened. Here's what you had to say about Meta 7.
I love it so much. It gives me so much energy during the day.
I've noticed a change in my hair, my nails, my blood pressure.
There's no doubt that it's a benefit to me. It gives me more stamina.
And it could actually help you lose weight.
Now, I haven't taken a nap in 6 months.
That's right, Meta 7. More and more people are sending in their testimonials. Weight loss, more energy, and generally feeling more alert during the day. Let's hear more.
I used it to help wean myself off caffeine and energy drinks, and my productivity has been very high lately.
It's natural, it's amazing. I feel motivated to get out and do things that I didn't before.
I'm not tired during the day. I've worked 12-hour shifts.
Just go all day. It makes me feel great. I love it, and take it. It's wonderful stuff.
If you haven't tried Meta 7 yet, it's time to order yours from Amazon. Time to boost your metabolism and kick your energy level into high gear. There's an Amazon link in the description.